Ladies and gentlemen, it's time now for us to talk about the next set of home remedies which are for various types of pain relief. Pain is any discomfort that we have in the body that will need us to quickly remove for us to live a convenient and comfortable life. So, the first one that we're going to talk about is muscle soreness. We can use an Epsom salt bath for that. Just add 2 cups of Epsom salt in a warm bath and then soak your whole body in the bath for 15 to 20 minutes. Epsom salts actually contain magnesium, which can help relax the muscles and reduce soreness. Okay. Others, if you have been injured, you can use an ice pack. Just use an ice pack or cold compress. Apply the ice pack to the sore area for 15 to 20 minutes and then repeat every 2 to 3 hours for the first 48 hours after the onset of soreness. Ice is going to help reduce inflammation and numb the area to relieve the pain. You can also use heat therapy. Just use a heating pad or take a warm shower. Or with the heat pad, rather, you apply the heat to the sore area for 15 to 20 minutes, and the heat is going to increase the blood flow to the area, which can promote healing and reduce the stiffness. Or you can use ginger tea. Just drink 1 to 2 cups of ginger tea. Boil a few slices of fresh ginger in water for 10 minutes and then strain and drink. Ginger has anti-inflammatory properties and that can help reduce muscle soreness. Others can try turmeric. Just 1 teaspoon of turmeric powder. Mix it with warm milk or water and drink it once a day. Turmeric has anti-inflammatory properties that can help reduce muscle soreness. You can also go for massage therapy. Just use a foam roller or get a professional massage. Gently massage the sore area to increase blood flow and reduce muscle tension. A foam roller can be used to apply pressure to the sore muscles. If none of those work, you can try some painkillers that do not have steroids in them. They're called non-steroidal anti-inflammatory drugs. Follow the dosage instructions on the packaging or use as prescribed by a healthcare provider. You have ibuprofen among a few of examples of the NSAIDs, NSAIDs, NSAIDs. I'm sorry for mispronouncing that, ladies and gentlemen. And they can help reduce inflammation and relieve pain. But usually, it's best to consult a doctor because you may actually find that they are not suitable for you. So a doctor is going to prescribe the exact one that is good enough for your own blood type. So you can also consider magnesium supplements. You know, magnesium is very good because it can relax muscles and reduce soreness. So when you get these ones, usually follow the dosage instructions on the packaging, or rather have the doctor prescribe them for you, because if you take them in the wrong way, you might also suffer some side effects. So the best way, though, regardless of whatever routine you are following, never forget to hydrate yourself. Drink at least 8 glasses, just about 2 liters of water per day, because staying hydrated helps flush out toxins and reduces muscle soreness. So drinking water throughout the day, especially before and after exercise, can help speed up the recovery of your muscles. What about joints where our bones meet? We can use turmeric and ginger for them. Just drink 1 to 2 cups of turmeric and ginger tea daily. This can be done by boiling 2 cups of water and then adding half a teaspoon each of ground turmeric and ground ginger. Simmer for about 10 to 15 minutes, strain, and then add honey to taste, because ginger has a very sharp taste. Enjoy twice daily, you are going to be fine. Or an Epsom salt soak. Just add 2 cups of Epsom salt to a warm bath. Soak in the bath for 15 to 20 minutes. And Epsom salt does contain magnesium, which we said is very good for muscles because it can help them relax and reduce joint pain. If You can also afford a professional massage or one for yourself. If you can do it yourself at home, you would probably want to consider doing the olive oil massage. Just use a small amount of extra virgin olive oil, warm the oil slightly, and then massage it into the affected joints 2 to 3 times a day. Olive oil has anti-inflammatory properties that can help reduce pain and stiffness. Apple cider vinegar. This one can also be used just one. Mix 1 to 2 tablespoons of apple cider vinegar in a glass of water and then drink the mixture once a day. Apple cider vinegar can help reduce inflammation and improve joint health. Others, you can also try capsaicin cream. Apply a small amount of capsaicin cream to the affected area. Just use 2 to 3 times a day. Capsaicin, which is found in chili peppers, can reduce pain by blocking pain signals. We have also spoken about painkillers that do not have steroids in them. We have mentioned examples like ibuprofen. You can also consider them, but make sure that you consult with your doctor first before taking these ones because they might not be good for your system. You can also go to a doctor and ask for glucosamine and chondroitin, yes, supplements. I'm sorry for mispronouncing these names, ladies and gentlemen, because I really am not a health professional. Take 1,500 milligrams of glucosamine and 800 to 1,200 milligrams of chondroitin daily. These supplements can help reduce joint pain and improve joint function. Just take them as directed on the packaging or by the doctor. Here is one common one that can help with the muscles, the omega-3 fatty acids. They are found in fish, almonds, and all the nuts that you see, or they can come in capsules or soft gels rather, that you can swallow, and then they can dissolve in the stomach and then get absorbed into the system. Take 1,000 milligrams of omega-3 fatty acids daily. They can reduce inflammation and improve joint health, or take as directed on the packaging. Sometimes you just have to go to a doctor to ask them to help you take them the right way. So some, especially ladies, you can be having you from time to time do experience some menstrual cramps. They can also be treated using a heating pad. Just use a heating pad or hot water bottle. Apply the heating pad to your lower abdomen for 15 to 20 minutes and then repeat as needed. Heat helps relax the muscles and reduces the cramping. Or you can drink 1 to 2 cups of ginger tea, just prepared by boiling a few slices of fresh ginger in water for 10 minutes and then strain and drink. Ginger has anti-inflammatory properties that can help reduce pain. Some can try chamomile tea, just drinking 1 to 2 cups of chamomile tea. It's prepared by steeping or rather mixing its tea bags in hot water for 5 to 10 minutes and then drinking as needed. Chamomile has antispasmodic properties that can help relax the uterus. You can also consider exercise, engaging in light to moderate exercise or activities like walking, yoga, and stretching can help increase the blood flow and reduce cramping. Okay. Or you can also use essential oils. We have plenty of them. We have here we have peppermint oil, we have tea tree oil, lavender, etc. Just use a few drops of essential oils like lavender or clary sage. You prepare them by diluting them with a carrier oil, preferably coconut oil, and massage onto your lower abdomen. Essential oils can help relax muscles and they can also reduce the pain. Hydration, don't forget, whatever method you are using, don't forget to take at least 8 glasses of water per day because staying hydrated can reduce bloating and discomfort. Let's not forget the painkillers like ibuprofen. We have already spoken about them. just take them as directed on the package, or have the doctor prescribe them for you. Magnesium supplements, we did mention how magnesium can help relax muscles and reduce cramping. Take as directed on the packaging, or is prescribed by your doctor. Other supplements that you can consider are vitamin B1 or thiamine. Take 100 milligrams of this vitamin per day. It can help reduce the severity of menstrual cramps, but usually it's a doctor who has to prescribe them for you, so you have to listen to their instructions when taking this one. So sometimes we do suffer from numb muscles. They're not painful, but they are just numb. They're difficult to move, and sometimes you don't feel them. It's quite uncomfortable. So you can use a warm compress. Apply a warm compress to the affected area to increase blood circulation and relieve numbness. Use a warm towel or heating pad for about 15 to 20 minutes. It usually gets the job done. Or you can do the Epsom salt bath that we have spoken about. Soak your whole body in a warm bath with Epsom salt. The magnesium in Epsom salt can help relax the muscles and improve circulation. So you need just about 1 to 2 cups of Epsom salt. It is going to help you. Don't stay too long, because Epsom salt also contains sulfur, which might end up causing some allergic reactions on the skin if it is misused. So those who can afford a massage can also consider gentle massage to the affected area with warm olive oil or coconut oil. This can help improve blood flow and reduce numbness. Massage in circular motions for about 5 to 10 minutes. You can do it daily or as much as it takes. Okay, I think we've already spoken more than enough about drinking ginger tea. Just prepare it as previously explained, by boiling a few slices of fresh ginger in water for 10 minutes. Strain and then add honey to taste. You can do this 2 to 3 times a day. Or turmeric, mix a teaspoon of turmeric powder with a glass of warm milk and drink it daily. Turmeric has anti-inflammatory properties that can help reduce body numbness. Another supplement that you can take is the vitamin B12 supplement. Take about 1,000 milligrams of them daily if you have a deficiency. Usually numbness is a sign that we are lacking some certain vitamins of the body. So vitamin B12 is essential for nerve health, and it can actually reduce numbness. Let's not forget magnesium. We did mention that magnesium is very good for the muscles, and it can also help improve nerve function. Take as directed by your pharmacist or your doctor. Other anti-inflammatory medicines that we can get over the counter, like ibuprofen, can also be prescribed or recommended to help reduce inflammation and relieve numbness. On this one, just take as directed by your health care provider. So the tips for managing numbness include staying active, continue exercising, engage in activities like walking, swimming, or yoga. Avoid prolonged pressure. It can come through sitting or standing in one position for too long. Take breaks and move around. It is going to help you with your numbness. And always stay hydrated. Always stay hydrated. Drink lots and lots of water, and you can also, yes, you have to drink lots and lots of water. I'm sorry, ladies and gentlemen, we are going to talk about burns in the next section. Thank you very much, everybody. So after that, we talk about the pain. Rather, let's just talk about the pain that is caused by burn right now. So the first thing that you do when your skin burns is to run cool water, cool but not cold water, over the burn area just for about 20 minutes. This will help reduce pain and swelling, but avoid using ice, because ice can actually cause further damage to the tissue. So you can also use a cold compress. Apply a cold compress or clean wet cloth to the burnt area. Use in 5 to 10 to 15 minutes intervals. This can help reduce pain and swelling. But make sure that your cold compress is not as cold as ice, because we've already mentioned that ice can lead to damaging other tissues below the burn. So you can also consider aloe vera gel. Just apply a thin layer to the affected area 2 to 3 times a day. It is going to give you some anti-inflammatory properties and promote healing of the burn. Others can try honey. They have also seen honey to be a very effective substitute. Apply a small amount of honey to the burn, or use 2 to 3 times a day, because honey has antibacterial and anti-inflammatory properties, and that can help heal the burn and prevent infection. So for long-term treatment, though, you have to go to the doctor to get some antibiotic ointments. Apply a thin layer like bacitracin or neosporin, but these come with the prescription from the doctor, so never try to take them alone at home. Directions: you have to cover the burnt area with a sterile and non-fluffy dressing or cloth, and then you rather start by cleaning the wound, and then applying the antibiotic cream, and then covering it with a dressing. This is going to help prevent infection and speed up the healing process. So avoid sun exposure, especially if you have burns, because um, the burnt skin is usually sensitive to the sun, so it's important to protect it. So there are so many things. It's either you wear a hat, or you stay indoors, or you wear some glasses and use a very big umbrella when you're outdoors. All those are ways of avoiding sun exposures. So most of the time, during that time, you will be feeling pain from time to time. So a doctor can prescribe some pain relievers like ibuprofen and acetaminophen. It also can help you, but use this as directed on the packaging, or as prescribed by your doctor. They can relieve pain and reduce inflammation. Never forget to drink as much water, because staying hydrated helps the body heal, and it can help prevent dehydration, especially if the burn is severe. But go to the hospital if the burn is larger than 3 inches, or if the burn is on the face, or hands, feet, or groin, or joints. Go to the hospital also if there are signs of an infection, when there is pus oozing out of the burnt area, or it is accompanied by fever and the pain is getting worse. And if it's a 3rd-degree burn, when the skin is charred, white, or numb, you also have to go to the doctor if you suffered a chemical or electrical burn. So sometimes we do feel some pain when we have some scrapes and cuts. So the first thing that you have to do is to clean the wound, and then rinse the wound with cool running water. Use mild soap and water to gently clean the area, and this will help remove dirt and bacteria and reduce the risk of infection. Sometimes if it's a minor scratch or cut, and this is usually enough to help the body to heal itself gradually. Or just to be on the safe side, you can apply a small amount of hydrogen peroxide to the wound. Use a clean cotton ball or gauze to apply the peroxide. This helps disinfect the wound, but it should not be used long term, as it can delay the healing. Aloe vera gel can also be applied just 2 to 3 times a day, because it has antibacterial and wound healing properties that can soothe and promote healing. Honey can also be used just by applying a small amount of honey to the wound. Just do this 2 to 3 times daily, because honey has some antimicrobial properties that can help heal the wound and prevent infection. We have already spoken about antibiotic ointments. Go to a doctor when you need this one. and then the doctor is going to be able to prescribe it for you. When you are at home, make sure that you apply a thin layer of antibiotic ointment like bacitracin or neosporin, and after that cover the wound with a sterile or non-fluffy dressing or cloth to prevent infection and keep it moist. Um, you can also consider bandaging the injured part. Use a sterile bandage or adhesive strip. Cover the wound to keep it clean and protected, and change the bandage daily whenever it becomes dirty or wet. So during the time you are going to feel a lot of pain from time to time, you can ask your doctor to provide to prescribe some pain relievers like ibuprofen and acetaminophen. These can help alleviate the pain and reduce the inflammation. Take them as directed by the doctor, or as written there on the instructions on the packaging. So never forget to keep yourself hydrated. Drink as much water as possible in order to speed up your healing. So what about when we experience pain that is caused by bruises? You can use an ice pack or a cold compress. Apply the ice pack to the bruised area for about 10 to 15 minutes, 15 rather to 20 minutes, and repeat once in every 1 or 2 hours for the first 48 hours, because ice is very good in helping um, reducing the swelling and numbs to relieve the pain. You can also consider Anica gel or Anica cream. Just apply a thin layer of Anica gel or cream to the bruised area. Use 2 to 3 times a day. Anica has anti-inflammatory properties that can help reduce swelling and speed up the healing process. So usually you need to elevate the bruised area, especially at the onset, um, in order to reduce the blood flow to the area, which can minimize swelling and reduce the size of the bruise. Alternatively, you can apply vitamin K cream. Just apply a thin layer to the bruised area, because vitamin K improves blood clotting and can reduce the appearance of the bruises. Do this 2 to 3 times daily for maximum results. Or you can apply a thin layer of pure aloe vera gel to the bruised area 2 to 3 times a day. Aloe vera has anti-inflammatory properties that can soothe the skin and promote healing. Others can use pineapple or bromelain supplements depending on where you are and what is available near you. Consume fresh pineapples or take bromelain supplement as directed on the packaging. Bromelain is an enzyme found in pineapple, which has anti-inflammatory properties that can help reduce bruising. So other pain relievers, or rather another method is using pain relievers. They can be given to you over the counter by a pharmacist, but it's best to get them from a doctor, because the doctor will examine you and see if they are going to work for you and not result in so many unwanted side effects. Okay, never forget, ladies and gentlemen, to stay hydrated, because staying hydrated helps the body heal, and it can prevent dehydration rather, especially if the bruise is severe. So sometimes we can actually fall at home and fracture our bones or limbs. So when this happens, first of all, immobilize the injured part. You have to tie a splinter around it to stop the bones from moving around, and then transport the patient to a healthcare facility. You cannot do that on your own at home. You cannot treat the fractures on your own at home. So if you haven't arrived yet at the hospital, or if you do not have access to emergency healthcare, you can Also, in the meantime, be using black caraway seed oil. Just warm the oil and apply it to the affected area. Massage it gently and cover it with a cloth and repeat a few times a day. The oil is going to help reduce pain and swelling. If you have castor oil at home, you can also dip a cotton cloth in castor oil and wrap it around the fractured area. So castor oil is going to help you by reducing swelling and promoting healing. If you have turmeric in your kitchen, just take a teaspoon of turmeric powder and add it into a warm glass of milk. Drink twice a day because turmeric has anti-inflammatory properties that can help speed up the healing process. You can consider also using pineapples. Just eat at least half a pineapple per day. Pineapple contains the enzyme that we spoke about earlier called bromelain, which has anti-inflammatory properties that can help with recovery from fractures and falls. You here are the painkillers we have already mentioned that a doctor can prescribe them for you so that they can relieve the pain as and when it occurs during the day. For long-term assistance, rather, you may want to consider calcium and vitamin D supplements. They can be prescribed to you by a doctor, or you can just get them over the counter from a pharmacist. Just follow the dosage instructions on the packaging, and you can expect these supplements to help strengthen the bones and promote healing. From time to time, you also find that you have to use the cold packs. Just apply a cold pack to the injured area for about 15 to 20 minutes at a time. Several days, you can do it several times throughout the day. Cold packs help reduce swelling, and they numb the area to relieve it from the pain. We have already spoken about aloe vera gel. Just apply a thin layer 2 to 3 times daily. It can help the skin heal and reduce scarring. So you can also consider just resting and elevating the injured part. Keep the injured area as elevated as much as possible. Elevation helps reduce swelling and it promotes healing. Last one but not least is physical therapy, or what others would like to call physiotherapy. This is actually done by a professional orthopedic surgeon. So just go there and consult, and they are going to recommend what you have to do to improve mobility and strength after a fall. There you go. All the best, ladies and gentlemen. Next, we are going to talk about respiratory